What is hemophilia? Hemophilia is the most common X-linked genetic disease. The term is most commonly used to refer to two specific conditions known as hemophilia A and hemophilia B. Hemophilia A and B are inherited in an X-linked recessive genetic pattern and are therefore much more common in males. This pattern of inheritance means that a given gene on the X chromosome expresses itself only when there is no normal gene present. For example, a boy has only one X chromosome, so a boy with hemophilia has the defective gene on his sole X chromosome, and so is said to be homozygous for hemophilia. Hemophilia occurs in about 1 out of every 5,000 live male births. Hemophilia A and B occurs in all racial groups. Hemophilia A is about 4 times more common than B. What causes hemophilia? Hemophilia is caused by a genetic mutation. The mutations involve genes that code for proteins that are essential in the blood clotting process. The bleeding symptoms arise because blood clotting is impaired. Hemophilia A is caused by a mutation in the gene for factor VIII, so there is deficiency of this clotting factor. Hemophilia B, also called Christmas disease, results from a deficiency of factor IX due to a mutation in the corresponding gene. A condition referred to as hemophilia C involves a deficiency of clotting factor XI. This condition is much rarer than hemophilia A and B and typically leads to mild symptoms. It is also not inherited in an X-linked manner and affects persons of both sexes. What are the signs and symptoms of hemophilia? With severe hemophilia, A or B, bleeding begins at an early age and may occur spontaneously. Those with mild hemophilia may only bleed excessively in response to injury or trauma. Hemarthrosis, bleeding into the joints, is characteristic of hemophilia. The knees and ankles are most often affected. The bleeding causes distension of the joint spaces, significant pain, and over time, can be disfiguring. Bleeding into the muscles may occur with hematoma formation, compartment syndrome. Bleeding from the mouth or nosebleeds may occur. Bleeding from the gastrointestinal tract can lead to blood in the stool. Bleeding from the urinary tract can lead to blood in the urine, hematuria. Is it possible to know if you are a carrier of hemophilia? The DNA screening methods are generally the most reliable. Prenatal diagnosis is also possible with DNA-based tests performed on a sample obtained through amniocentesis or chorionic villus sampling. What are treatments for hemophilia? The mainstay of treatment is replacement of the blood clotting factors. Clotting factor concentrates can be purified from human donor blood or made in the laboratory using methods that do not use donor blood. This type of therapy is known as replacement therapy. Clotting factor replacement therapy is carried out by infusing the clotting factor concentrates into a vein, much like a blood transfusion. I hope this helps to answer the question. If you have any thoughts on this subject, please let me know below the comments.